A leading research and advocacy organization has come out with a new recommendation for women to prevent ovarian cancer.
The Ovarian Cancer Research Alliance is urging more women to have their fallopian tubes removed. The organization recommends it if they are finished having children and if they already have a gynecological operation scheduled. The guidance is built on evidence that this cancer originates in the fallopian tubes, not in the ovaries. Dr. Jamila Perritt joins us now. She is an OB-GYN as well as the president and CEO of Physicians for Reproductive Health. Thank you so much for joining us. So why is the Ovarian Cancer Research Alliance making this recommendation for more women?
Well, I think it's important to put the recommendation within the context of all cancers that women experience in the United States. We know that the likelihood of an individual being diagnosed with cancer historically has been dropping if we look at rates over the last 20 years, and the survival rates are certainly going up. But what we know is that those improvements in health outcomes and survival and decreased death rates are not felt universally, and that distribution is shaped by the kind of cancer that you have. Ovarian cancer is a rare cancer, but it's one of the most deadly ones. And so if an individual is diagnosed with ovarian cancer, the likelihood of surviving is much lower. And some of that is related to the lack of screening tests for ovarian cancer. So if you think about the screening tests that we have for reproductive health cancers, like breast cancer and cervical cancer, we know that getting regular Pap tests and getting your mammograms decreases the risk of being diagnosed with breast cancer and also increases the risk of survival. The same is not true for ovarian cancer because we don't have good screening mechanisms in place.
Well, doctor, I think a lot of women will wonder, are there potential health risks or side effects in having your fallopian tubes removed?
I think it depends on how you think about side effects or risks. So from a medical and scientific standpoint, probably not. Right? Typically, and what the recommendation is just not for everybody to go out and have their fallopian tubes removed, but it's talking about having them removed at the time that you're having another surgery. So people undergo gynecological surgery for a number of reasons. So think about fibroids or needing a hysterectomy. And so what the recommendation is saying, if you're having another surgery done, then it's a good chance to have your fallopian tubes removed at that time. Not saying you need an additional surgery or go in for it specifically if you're not at increased risk because of genetic inheritance, for example. So the risks really aren't tied to medical risk necessarily or long-term complications from it. But what we are concerned about is the way that folks understand and analyze their own risk, because really this has to happen in a conversation with your healthcare provider. What is my risk? Am I at increased risk because of family history or because of other things that are happening in my environment? And is this the right decision for me? It's not a universal recommendation, but a qualified one.
That's key there. Well, women with certain genetic mutations are at a higher risk already for ovarian cancer. So what steps do you recommend women take to find out if they have those specific mutations?
Really good question. We are really sure that there is one specific genetic mutation that increases your risk for both breast and ovarian cancer. And most people are familiar with this. Sometimes it's called BRCA or BRCA, a genetic mutation. And we're good at screening people with increased family risk for those kinds of mutations. For the most part, what we do know is that there are racialized differences in screening rates. So Black women, for example, are less likely to be screened for these genetic mutations that increase your risk of ovarian cancer and breast cancer. And as a result, the decisions that we make are not informed in the same way. And so the first thing that I would say is, regardless of your race or ethnicity, talk with your healthcare provider about your genetic risk and whether or not you should be screened for this mutation, because that can help shape the decisions that you make about surgery or not surgery or lifestyle changes or whatever may help decrease your risk of contracting any kind of cancer, including ovarian cancer.
Dr. Perritt, it sounds as though you're saying we should insist on it.
I think you should. I mean, the best thing that you can do for yourself as a patient, and what I do for myself as a patient, is to advocate for myself. But I also want to say that it can be hard to do. The power dynamic within relationships with healthcare providers, particularly physicians, can be tough to navigate. And often patients don't feel comfortable speaking up and saying, this is something that's important to me, and I want to have this service, this care, this procedure done. And so, one, finding a doctor that, or a healthcare provider more broadly, that you are comfortable having these conversations with, that you trust, and that trusts you to make the decisions that are best for yourself. So absolutely advocating for yourself in that moment, particularly if you have a strong family history of cancer, can be really critical.
It's why conversations like the one we're having right now are so very important. Dr. Jamila Perritt, thanks very much for sharing your insight and expertise with us.
It was my pleasure. Thanks for having me.